Hello everyone, I'm Dr. Samana Nadik. So hair fall is one of the major issue that people face day in and day out. Coming to causes of hair loss both in men and women, the prominent cause is genetics. So in family you have history of hair fall, alopecia, then it is sure that you can have alopecia too or hair fall too. Along with that, nutrition is one of the major cause that can lead to hair fall, especially in female. We see anemia. It can happen in male as well, but most predominantly we see in females. So when the hemoglobin is less, there's no nutrition or no supplements present in the body for the hair follicles to form new hairs, thus gives rise to hair fall or baldness. And other vitamins like vitamin B12, biotin, zinc is also very important. Proteins are very important for the hair to grow. So when these deficiencies are seen, there is possibility of hair fall happening or alopecia happening. Apart from this, certain medical health conditions like diabetes, chronic illnesses like hypertension, medicines taken to combat these illnesses can also cause hair loss. With this lifestyle, getting exposure to pollution, using hair dyes, hair styling methods, using heating, hair coloring, hair dyeing can also be harsh to your scalp, leading to hair fall. So these are the common causes which we see both in men and women. Coming particularly in men, there is something called male pattern baldness, which is also known as androgenic alopecia or androgenic hair fall, which is due to hormonal imbalance. It can happen in several stages depending on the hormonal imbalance. We generally see it in 5 stages. It especially starts over the frontal region or in the sides and tend to recede back. So there is a receding hairline seen. So this is because of disturbances in androgen levels or DTH levels. There is also a possibility of hair fall due to low testosterone levels. So low testosterone levels also leads to hair fall in males. Coming to females, there can be hormonal issues like thyroid, PCOD, PCOS, which can lead to hair fall. And there is physiological as well. During pregnancy, certain women see hair fall happening, or even after childbirth there is a lot of hair fall happening. This is due to hormonal imbalances, and these can be corrected or it can rectify on its own. If it is severe, then medicines will be required. Apart from this, both in men and women there can be certain treatments which you were undergoing, like chemotherapies or any medicines, prolonged medicines for diabetes, blood pressure also has a side effect, or any steroidal medicines for very long time, as a side effect you can see hair fall happening. Yes, seasonal changes also happen when it comes to hair, because we are exposed to harsh changes in climate, especially in autumn and spring. When there is sudden changes in weather can lead to dryness of the scalp, leading to hair fall. So especially when this temperature changes from summer to winter or winter to summer, most of them complain of hair fall, which is natural and it can be corrected on its own because it is a natural phenomenon. It can happen on its own and also get rectified on its own. So there are several homeopathic medicines which can help in regrowing of hair. So we need to understand what is the cause. Is it hormonal issues that is causing? Is it the androgen imbalance leading to male pattern baldness or female pattern baldness? Or is it any lifestyle modifications that is needed? Is it nutritional deficiency leading to hair loss? Depending on what is the cause, we try to understand the symptoms, analyze the symptoms, and see what is the best approach or what is the best medicine that has to be prescribed. So there is no any specific medicines that can be given. It depends on what symptoms you have, what severity you have. We match symptoms to the disease, and we also collect if there is any mental symptoms. Is it stress leading to hair fall? Depending on what is the cause, we try to match the homeopathic remedy. So homeopathy deals both with mind and body. It covers all the symptoms, and when one constitutional medicines or through holistic approach a medicine is selected, it can help in altering the issues. It can sort the hormonal disturbances and also stop the hair fall happening. After prescribing homeopathic medicine, so generally we need to wait for few months. It's not because of medicines, because hair growth takes time. So each hair has a hair cycle which follows. So there are different stages of hair cycle, and if different stages has its own duration. So one phase may have 1 to 2 years, one phase may have few months. While the hair is growing, it takes few months. Every month hair grows few centimeters. So if you have to see agreeable or noticeable changes after medicines, you have to minimum wait for 3 months. You can see changes initial months, you can see baby hairs growing up, you can see tiny hairs coming up, but to see dominant change or a drastic change, minimum of 3 months is a must, because hair growth, hair cycle itself takes time. So hair is also one thing which needs a moisture content, nourishment for it to grow well. So hair follicle, maintaining the moisture, hydrating it becomes important. So coconut oil is one of the best oil that can maintain the moisture, hydrate the hair well, and can keep your hair well. There are also many oils like rosemary oils, which helps in reducing if there is any inflammation. It also stimulates the hair growth. So make sure you oil your scalp before you take shower or use a shampoo, because frequent shampooing may also cause dryness. So when you use oil, it helps in maintaining the moisture and helps in reducing hair fall. So frequent oiling is one formula that you can use to reduce hair fall.